Hey Siri, how is Nigeria?
Did you say, what is cholera?
No, Siri, how is Nigeria?
The typhoid fever is present in Nigeria.
That makes sense. 20 million people get typhoid every single year. It's really unfortunate that this still continues, and it really doesn't make sense given that this disease has both a vaccine and a cure.
Do you mean a laxative and a lure?
No, Siri, you're the only one diseased here.
Sorry, I didn't quite get that.
The reality is that in the US and other Western countries, issues such as typhoid are ignored by the wider audience, despite infecting over 20 million people around the globe every single year. This issue tears families apart. Whether it be siblings, sons, fathers, or mothers, millions of people die from this disease, which ends the futures of the next generation. And that's what we're here to end.
And that's exactly the vision that our typhoid team has. It is completely astonishing that typhoid continues to infect millions throughout Nigeria and Bauchi State. With your support, we will be able to spread awareness of the disease, prevent future infections of typhoid, and treat the cases that do unfortunately occur.
As we know, typhoid is extremely common in Nigeria. And one of the main reasons as to why this is so common is because a lot of these countries are experiencing poverty, meaning they don't have access to basic drinking water, or they might not have access to sanitation. And with Bauchi being in the northern part of Nigeria, they're in the more rural and rural part, so they don't necessarily have the same access to resources and don't have the same access to awareness that perhaps urban areas have. So that leaves a lot of the cases to be untreated because a lot of people don't recognize the symptoms of typhoid. So unfortunately, 10 to 30% of those cases do end with fatality.
Nigeria, as a developing nation, has a variety of social factors which change healthcare within its borders, from poor water due to the sewage system and limited sanitation. All of these factors have led to typhoid outbreaks. Also to income disparity from the southern to northern Nigeria, public health in Bauchi is unique. Corruption, violence, all other negative factors scar society, leading to an often sometimes troublesome environment to practice medicine. For example, for the primary healthcare system, the majority of them live in villages, as you can see, and their jobs conclude farming, oil extractors, or they're unemployed. So it would be more acceptable for them to contract typhoid because they're always so exposed, because they're always living outside and they're living in harsh conditions. Also, since this tier lacks infrastructure and funding for treatment and prevention, it's difficult to implement due to the lack of specialists and doctors that specialize in this disease. Although Nigerians living in this tier, secondary and tertiary, they would have more of an advantage of not contracting the disease because hospitals are more supported by the government and the people living in these conditions have access to the right protocols. Although all of this is happening, the health literacy rate is still lacking, and economic inequality between northern and southern parts of Nigeria have a long history of tension. So also not to mention, the poverty rate in Nigeria is ever growing. Researchers have stated in 2018, 40% of Nigerians, which equates to 83 million people, are living below the poverty rate line. Also, researchers have estimated that the poverty rate is still exponentially growing. So with all of these social factors still so relevant, we have determined that to treat and help prevent it, it would be very difficult due to the political state.
So, there's probably drivers among us here. I have my driver's license in my hands instead of flashcards. Because our bodies work really similarly to a car. When we are about to encounter a crash, what do? We honk, right? We're like, hey, let's fix this. Well, we have symptoms for that. Symptoms are a warning sign of an inflammation. They're our body's way of saying, pay attention to me. I need help. I need help where? What's happening to me? That's where we have the anatomy of the disease.
So, first of all, how do you even get this disease? Well, the Salmonella typhi bacteria infects your system through feces or urine. And the overall sanitation of a community can really determine the rates and how many people are diagnosed with this. So you see if you wash your hands or don't wash your hands, that can be an indicator. If you go to the bathroom, forget to wash your hands, or if you're cleaning up some sort of feces, there could be potential for getting bacteria and an infection. If you get that bacteria in your food, in your drinks, and if you have hand-to-mouth contact, you can get an infection. So once this bacteria enters your body, it goes down your alimentary canal, and it specifically really impacts your digestive system. Now, in your digestive system, it will replicate, especially because the body is a perfect place for it to replicate and for it to grow. This will then enter the bloodstream and pretty much just like overwhelm your body with bacteria, and that will cause the symptoms that were previously shown. So we really need to be teaching people about this. And that's what we have our outline and overview.
By the end of our workshop, participants will be able to identify symptoms of typhoid, take preventative measures, understand the treatment options available, and educate themselves on the typhoid epidemic and raise awareness.
Specifically, we will be conducting a workshop in Bauchi, Nigeria, and specifically centering on the federal low-cost community. In that community, we'll be targeting families, because ultimately, families are who will become the next generation of elders, both the parents and then the children. So we want to target families, and those are the people who will be coming to the workshop. We have a very clear goal with our workshop. The goal is to make sure that every single person who comes to the workshop leaves with a clear idea of what typhoid is, what its symptoms are, how to prevent it, how to treat it, and ultimately they will use the knowledge from this workshop and implement it into their daily lives. We want to do a workshop in Bauchi for 3 key reasons. Firstly, because the facilitators will be LI staff who have done workshops like this previously and have the expertise in order to conduct it effectively. Secondly, because workshops provide resources and education for people who otherwise may not be able to access that education. And lastly, because there's a large population in Bauchi, Nigeria, which means there's room for growth, and it means that we can be a small piece to a much larger puzzle. In our timeline, we will have 2 months in order to prepare for the workshop, 2 weeks to gather resources, and then in the upcoming 2 days before the workshop will be assembled and all materials will be finalized.
So this leads to the first activity in our workshop. And it's not one specific to health literacy, prevention, or treatment, but rather a combination of all 3. We wanted to ensure that our activities were accessible to people regardless of where they're from. And we've discovered that bingo is widely popular throughout both the US and Nigeria. And either way, we can ensure that bingo is accessible to everyone, as bingo is easily teachable, ensuring that everyone can enjoy the workshop. So what we aim to do is to host a bingo session using information from all 3 of our small teams. Using this, participants will be able to learn about the symptoms of typhoid. They'll be able to briefly learn about the prevention methods of typhoid, and will be able to learn how doctors work to treat typhoid in a fun, engaging, and easy way. As call-outs are made, LI staff at the workshop will be able to guide the discussion and ensure that the participants will be able to easily learn the information that is being cast onto them.
The main objectives of our workshop is to inform participants of the nature of typhoid, how the fever develops and spreads, its symptoms, and its need for medical care.
So So first, before we start our actual lesson, we're going to hand out a quiz. Now, this quiz is going to be the same as what we're going to hand out at the very end, but these, as you can see here, are the different symptoms, and some of them are actually different symptoms that can throw you off, just to see what all people associate with typhoid. So you can see what the knowledge is like before. You can take a look after the assessment to see how well the lesson worked. And then you can also see from this what questions arise, so you can make sure that you can clear up any confusion. And this will really help people retain the information because they know that there's going to be a quiz, and afterwards they can compare their answers from before and after, and they can sort of see, okay, these are some of the things I really need to be paying attention to and watch out, especially for their children.
So another activity is we're going to have a handout, which is a basic picture of the human diagram, and participants are going to be each given this handout and like 10 rice grains along with it. And so basically this will teach them how the bacteria starts and spreads. So like for instance, like a question would be like, put the rice where like the bacteria enter the body, because the rice symbolizes Salmonella typhi, the bacteria that causes typhoid fever. And participants would put this over the mouth. And then another question would be simulate how the bacteria moves throughout the body using the rice. So they would trail it through the esophagus and through the GI tract, where the food, or that organs that absorb food and water, or the infected food and water. And that'll teach them how it starts and grows, and essentially the symptoms, so why the symptoms are caused by this bacteria.
We want to put these flyers all around Bauchi to inform the people of Bauchi about how you get typhoid and the symptoms. The flyers will be placed in waterways, schools, and markets, and given to village leaders so that people can easily access them.
This will be one of the flyers placed around the community to inform members of the dangers of typhoid if they do not wash their hands before they eat.
Washing your hands is one of the most effective ways to prevent yourself from typhoid. As we know, typhoid is transmittable through the fecal-oral route, so by washing your hands after using the bathroom and before eating ensures that there are no fecal pathogens still on your hands and that they are ready to use. And so you don't prepare food with fecal pathogens still on your hands and accidentally infect yourself. And also, food preparation and water management are also extremely important. You want to take the time to make sure that the food and water you're getting are clean. So for example, eating hot foods at a restaurant rather than eating at a street vendor, because you don't really know where the street vendor's hands have been. And also, if possible, drinking water bottles can be more effective, because a large majority of Nigeria's water is infected with water from the sewers. So just taking the extra step to know where your food comes from and if your food and water is clean can really help you in the long run.
Cleaning bathrooms, high traffic areas like kitchens can help reduce the spread of germs. For this, you could use soap and water. While typhoid doesn't spread by oral droplets, it is still important to keep a distance to protect others from being exposed. The prevention workshop was designed to teach all the effective and necessary steps to prevent the spread and contraction of typhoid fever. The workshop will include demonstrations of hygienic practices, such as how to properly cleanse your hands and like how much soap you should use and how long you should do it, for like 20 seconds at the very least. It will also include alternatives to hand soap if it's not available, such as ashes, and it will include a quick true or false Q&A quiz that will see how much you know or how much you need to know about adequate sanitation. The workshop and we, the people behind the workshop, intend on helping the people take
their part in the obstruction of typhoid fever, and to help ensure that it's not in our daily life and it does not affect us anymore as a community.
By the end of the workshop, we will give participants 3 flyers. The first is an effective guide to washing your hands. On this poster, there are 4 steps to washing your hands, each with a visual aid and a written description underneath. The second is a guide to how long your food can sit out before it goes bad. There are 6 images, 4 animals, 1 fish, and 1 group of foods that Nigerians may eat. Underneath the images are time limits for how long each food can sit out before it goes bad. The third is a general information guide for typhoid fever. It includes the seriousness, preventative measures, ways it is transmitted, and symptoms so families know what typhoid fever looks like. Our hope is that these posters serve as a reminder for what they learned in our workshop and to further influence the prevention of typhoid fever.
The treatment regimen for typhoid fever includes antibiotics, antipyretics, and proper hydration and nutrition. Antibiotics are the main treatment for typhoid because they actively fight the bacteria in your body and they help stop the multiplying of bacteria in the body, which helps the natural immune system fight off the disease. Antipyretics are given to patients with high fever symptoms and they help ease the fever and calm the patients. And proper hydration and nutrition are very important because many nutrients are lost through throwing up and vomiting, which is a common symptom of typhoid. And drinking water and eating proper meals is a great way to regain lost nutrients and flush out the bacteria in your body. Some common antibiotics for typhoid are ciprofloxacin, ceftriaxone, and erythromycin. Ciprotab is the main treatment for typhoid, and it is given in doses that vary based on the patient's gender, sex, height, and weight. Azithromycin is also an option because patients can have it if they've gained a tolerance or resistance to the ciprotab medication, and it also can be used by pregnant women. And ceftriaxone is also used for children, and it is the IV form of the drugs.
So as for the progression of typhoid, the basic progression of typhoid can be broken up into 3 basic weeks, with the severity of the symptoms increasing as time passes. And so for week 1, a patient generally experiences mild symptoms from bodily discomfort to headaches and to even sore throat. In week 2, the major and more larger organs are affected, with one such being the skin, where rose spots appear, which are rashes, and hepatosplenomegaly, which is an abnormal enlargement of the spleen and liver, and mild bradycardia, which is a slow, abnormal heartbeat. And so generally, during this time, the best and most effective treatment is antibiotics. However, we don't want to just explain what antibiotics are and the importance of them, but we also want to explain the consequences if you don't follow a proper antibiotic regimen. And so in this case, we want to explain antibiotic resistance. If the patient doesn't follow the right treatment process with the prescribed medication given by the doctor, the bacteria can develop a resistance to this medication, now deeming this medication to be ineffective. And this can lead the patient into week 3, which is typhoid state. And so in this state, this is where the most severe symptoms occur, where the intestine can hemorrhage and perforation can occur, which is where holes appear in the intestine. And so at this point, the patient would require surgery. And so during this time, we want the patients to understand how truly dangerous typhoid state can be for them, but we also want them to understand that the treatment for this is so much more expensive and much more complicated than trying to prevent it in the earlier stages and using antibiotics.
Now that we know about the different treatments, we need to get this point across to the people of Nigeria. Well, how do we do that? What's better than a fun, interactive, and engaging game? How does it typically work is that there will be 6 posters around the room. And as you see above, it will have an intestine with 6 or 7 typhoid fever symptoms. Then each participant will get 7 flashcards with different treatment options that will match up to one of the symptoms. They will get into groups and they will discuss this, and then each group will go up and put the treatments that will match up to the symptoms.
The point of this is to get people familiarized with what the symptoms are and what treatments goes directly with the different symptoms. A lot of people just see these treatments as words. They don't really know what it means and what directly it helps with, but through this game they'll know, through these different pictures, what does it directly help with, and they'll be more comfortable with taking it. After this, we'll have a short description of each treatment going into depth about what it does and how they can get it. And this is our typhoid poster. In this poster, we have 4 steps that kind of go along through finding out that you have typhoid to the end of it. And you could follow along with this poster. And it serves as a guide to show, now that you have the symptoms, what do you do next? You go to the doctor, you take the treatment, you do follow-up. And it's an easy way for them to follow along and just understand what they have to do and when they have to do it. And this will be given to each participant along with being put around the clinic and around the area.
So one of the main things we want to emphasize and do through our workshop is teach the people in Nigeria about typhoid and about the treatment, prevention, and anything that we do. Because our main goal is for them to know what they're dealing with and for them to be able to know when to go to the hospital and figure out their symptoms and just understand what we're trying to do and understand that all we're trying to do is really help them. So as we mentioned at the beginning, one of the first things we will be doing in our workshop is a bingo game that will also help them understand different symptoms, different things about the treatment, prevention, and typhoid in general. But as for the treatment, we also have a pre and post test as an evaluation. So when they take the pre-test, it will give facilitators an idea of what really needs to be emphasized more and how much knowledge the people already have. And then the same test will be given as a post-test at the end of our workshop, which will tell us how much they learned and if they understood everything clearly, so we can clarify any questions or any doubts they have. So here's a picture of how the pre and post-test would look. It's a couple multiple choice questions that they would just have to fill out and submit to us whenever we conduct the workshop.
On to funding. Each of the 3 groups will in total have $450 that they will be using to conduct the workshop. Out of that $450, $400 of it will be allotted with prevention and treatment having roughly equal amounts of budget and health literacy having $50. In this, when calculating the funding, we made sure to add extra money, and we always rounded up with our calculations to ensure that there is extra money available for when things go wrong and when alternatives need to be found. That way, for the people who are setting up the event and actually buying the materials, they can have the funds to do it and can focus on creating a good event and not just staying inside of the budget. These prices reflect the price of commodities in Nigeria. So all these prices all of the materials for the workshop will be bought in Nigeria and then moved into the location of the workshop. And to provide easy accessibility to these supplies, we made sure and selectively looked at all of the materials to ensure that all the materials were easily accessible to the people who would be buying the materials themselves.
So some other things we have included in our budget are the bingo boards. So printing out the bingo boards we calculated would be about $50 from our budget. And the funds, a lot of the funds that we have were used for activity supplies and posters and things to advertise our workshop and really make it hands-on and interactive so that the participants can really understand and enjoy the workshop and learn everything. We also put $250 of our budget towards refreshments for people that attend our workshop. We wanted to take into account that a lot of people have busy lives in Nigeria, and due to the standard of living, they might have to leave work, or maybe since they're bringing their families, they have to bring their kids and transportation and things like that. And we wanted to take into account of all of that, so we wanted to provide some sort of incentive. And we thought that if we could provide refreshments, as in like food for lunch or whenever we have the workshop, that would make it easier for them to come and participate in the workshop. The rest of our money, we have $850 left, and we wanted to put this towards the federal low-cost community, which
Yes, so the money that's left over from the workshop budget will be donated to the Nagari Medical Clinic as a co-pay budget. People who come to the workshop will have 50% of their appointment cost covered by this co-pay budget. The budget will be, as Srisha said, $850 US, which is the equivalent of 354,000 Nigerian Naira, and this will cover all treatment and appointment costs. Typically, a copay can be as small as 5,000 Naira and as much as 50,000 Naira for a minor surgical operation. And assuming that the average copay is 15,000 Naira, the funds can help provide medical treatment for around 25 patients at about 7,500 Naira per patient. However, as surgery is less common than walk-in patients, the average pay will realistically be lower. So, roughly around 30 to 35 patients can access the 50% discount. This would also be an incentive for people to come to our typhoid workshop, as attendee names and date of births will be recorded. And as long as the funds last, participants can have access to this copay discount.
Typhoid fever is still a very prevalent issue in northern Nigeria, causing many complications and even death when infecting the poorest of the population. Our group wanted to implement and make a lasting impact on the community by creating an accessible, accurate, and affordable and simplified plan to educate the population and the communities affected.
So before we end today, there are a few alternatives for our workshops that we have considered and are easily able to be factored into our budget, as we have considerable extra room. So currently, we have engaging discussion in every single one of our workshops. However, we want to have that flexibility room to ensure that everyone is getting the best experience possible. For example, in the prevention workshop, although we are already having engaging discussion and work between allied staff and the participants, we could also have a sort of UV activity in which UV light and gel could be used for the participants to really see the bacteria that is on their skin. They will be visibly able to see that if they do not clean their hands, they will get sick, and it's an easy way to really demonstrate how deadly these diseases can be. We really want all of our experiences to be as engaging and rewarding as possible, and our goal has never been for our activities to be the discussion, but rather the thing that drives the discussion. We want everyone to take home something that they can take home to everyone else. We want them to be able to really learn from these experiences and be able to grow and protect themselves as a result. Thank you.
Once again, just thank you everyone for your time, and we want to give a special thanks to the panel, Max Umar and Dr. Aisha, for carefully considering our proposal. And we also want to give a heartfelt thanks to our team leaders, Nishi, Rishika, and Jakin, for all the work and efforts that you've helped us do this work. Thank you.
All right, well, let's move on to feedback. We'll start with you, Umar, this time.
Oh, you started with me? Hi, Siri. Back to your team now. All right. Nice job, guys. I really enjoy your presentation. Honestly, I don't know. These presentations are a surprise to me. The drama is actually it's a practical example of what you guys mean by putting those games from the beginning. And I totally understand that whenever you're a stranger, you stand before people, you need to engage them to make them relax. I like that word. Because this is more or less like a technique for you to kind of get them involved into the whole situation. And that is the best method of also passing the message to these locals. So I like that. The confidence. it's also an important tool. Whenever you are presenting something to people, be confident of yourself. You started, the start of your presentation has given confidence to most of your team members, which is really, really important. And this is exactly whenever you're conducting anything, you have to be confident of what you're presenting to people. So I really like that gesture. Interactive session by using the bingo, we call it. It's really tricky, and I look forward to see how that is going to work. But it's really amazing, and I'm really impressed how you're kind of like trying to make them see it or visualize it and place it in the right positions for them to know exactly what the situation is all about. Because typhoid is a little bit tricky than malaria in terms of understanding. So that's also a very good point. Yeah, so you also explained it clearly how the pre and post test is going to be used, which is exactly what I'm expecting to hear. But you have cleared it that you have to place this assessment from the beginning to assess their level of knowledge, which will give you the opportunity to know exactly what you're going to impact in the lives of these people. That's a smart thinking. You also explained, even though I know we have some judges at the backstage that they ask you some key questions, where you're placing your money is also important. And I realized that you mentioned that you're going to put some money to the hospital so that when people or those who participated are going to get like a discount or something like that, which is actually a good idea because I was looking forward to see how you can defend that. But you have said it all. One of the observations that it's very, very key, not just to your team, but to everyone presenting, is that at the end of your workshop or at the end of everything, you need to give a suggestion for people. Like, hey, if you have this, don't try treating yourself at home, self-medication. Let me tell you, you put a lot of things there that after the program, maybe some people, they will feel like, oh, I learned this stuff, so I become a mini doctor as well. So they will begin to think of self-medication. So try as much as possible to encourage them that you cannot be, able to determine whether these things are accurate to when you visit the doctor. Kind of like just giving them something that will tie them to make sure that they visit a hospital, not just start treating themselves. Does that make sense? But you guys have done incredible, and I'm really, really happy that I get the opportunity to work with all of you this week. And you guys are amazing. Thank you very much.
Dr. Aisha, your thoughts?
Yeah, gladly. So well done, guys. Typhoid presentation was really elaborate. I liked so many parts of it, especially the part where you mentioned alternative means to hand washing. Okay, from the lectures, I always tell you at some point you have to improvise due to maybe lack of resources or lack of enough funding. Sorry, guys. Lack of enough funding, So it's always good to find an alternative means to something really important. Okay? And you have mentioned how really important hand washing is, so if there's no soap or sanitizers, someone made mention of, the ash. Okay, it's a really good way. So really well done in that regard. And of course, the bingo game again. I'm personally not familiar with the game bingo, so I would have loved for more explanation as to how that goes. Of course, fun ways of trying to get your message across is a really good way to go about it. But personally, and like you said, it's a common game in America and Nigeria, but I'm not sure. Funny enough, I don't know that game. You can either explain it here if there's enough time or any other time outside of here. The prevention number 3 flyer, it's not so clear. I tried to squint to really see, because it's a really important slide. Okay, prevention of anything is really, really important. So I would have hoped and loved for that flyer to be bold and, saying that this is what we wanted to do, but I'm sure it contains a really important information. And the copay support, I'm really interested to, or it's really interesting to hear about it, because over the years I've never heard of this point before, and it happens to be a really the very first time students are suggesting it or are mentioning it in their presentations, and it's really a wonderful idea. Well done. And lastly, the health literacy and your budget and how you distributed the budget. You said $50 is going towards health literacy. Personally, I think $50, because health literacy comprises of everything. The prevention, the treatment, the whole information about the disease itself. So I feel you should revisit the budget regarding that health literacy, because it seems like the biggest part of your job, okay? Because you want people to know about it. You want people, so you can visit the media stations, radio, the TV stations, social media, So I just feel $50 is not enough of budget to cover that. All in all, you guys did really, really wonderful. I like the confidence. I like the little drama. It's a wake up message, okay? And well done, guys. It was awesome. Okay, thank you.
Yeah, I think the introduction was really indicative of the presentation as a whole. It was compelling, it was engaging, and I especially loved the discussion of access and the social determinants of health at the beginning. And that really then set yourself up well for talking about subsidized medicine and the copay, because access really often is the one barrier to treatment, and if that access is money, there are so many things that we can do to make healthcare more accessible and more affordable for people. So having that option, especially for the attendees, I think will do a lot in terms of treatment and prevention and building health literacy by actually engaging with the healthcare community. The graphics I thought were all awesome. The bingo board was really cool. I think it's really simple for people to grasp that concept. So really just matching things up and just talking about the political context of everything, I think is really important. And the last thing I wrote down was how impressed I was that we talked about the consequences of not following a regimen and of not properly taking antibiotics, because that is not only helping the individual potentially heal faster and heal fully, but also helping the broader community and in many cases the world by working to fight antibiotic resistance. So there's a lot that making sure people stay on the regimen and understand the consequences of not doing that has on impacting all of our health. So I thought this was really awesome.